my name is Samantha Bruno and I'm going to show you how to put on sterile gloves correctly. So, when you are putting on sterile gloves, most people assume that you are in a doctor's office and you're going to perform surgery. That's not always the case. Sterile gloves help protect a barrier between your actual hands and any material that you might want to not touch. So today, obviously, the items you will be needing today is obviously a pack of sterile gloves, and in some cases a pack of sterile scrub that will help you wash your hands, but I'll explain that more later. So the two main keys to while you are putting on sterile gloves is to make sure that the package is not damaged or open. Obviously this one is used for demonstration purposes, so it's obviously not sterile anymore, but the damaged one, this is obviously damaged and not sterile anymore. This package, however, is perfectly sterile. The only part that should be opened is the little flap to obviously open it. The second key when you are putting on disposable gloves is to make sure that, or the surgical gloves, is to make sure that they are your correct size. These are obviously two different brands and two different packaging. For this brand, the Nutriderm, I think it's pronounced, is the sizes ranges from 6 to 9, and then the Dermassist ranges from 5.5 to 9. So obviously this one has a little bit wider range in sizes. So before you put on your sterile gloves, what you want to do is to make sure you have no jewelry and all your sleeves are pushed up completely. You do not want your sleeves or any other material to be in the way, because obviously those are not sterile and you cannot sterilize those. Another key is to make sure you wash your hands, and this is where the surgical scrub comes in handy. So before you do even put on the gloves, you want to make sure that your hands are clean. This is obviously a sterile pack because it is not open. So once you get your surgical scrub kit, you are going to open the package just like this. And on one side is the sponge with the soap, and then on the other side, as you can see, is the bristles. You want to make sure that you scrub with the soap to make sure your hands are fully lathered in the soap, and then to make sure you scrub completely with the bristles for 2 to 4 minutes. If your nails are longer, then you will use this item right here, which is called a nail scrub, to get underneath your nails, because you want to make your hands as sterile as possible. So once you scrub your hands and make sure that they are perfectly clean, you want to make sure that they are above waist, because a key rule into putting on sterile gloves is that everything waist down is no longer sterile. So you want to keep them up, and you want to keep them pointed away just like this. Just think of it as watching Grey's Anatomy. When they do their scrubs, they keep their hands like this at all times. And make sure, like I said, to keep them above waist. So, as for this purpose, I'm just going to show you first on how to do it and show you step by step. Obviously, this package right here is not the correct way to put it, but I'm just going to show you step by step, and then we will later do it with the correct way, how to put the gloves on with this package. So when you're putting on sterile gloves, your provider or anyone else that you are doing the surgical gloves with will already have this open, and it will be obviously sterile. So your provider will have these open, or any other person that is provided into the facility that you're using the sterile gloves for, which could be a number of reasons, as procedures or certain simple tasks that your provider may want you to have. As for me, I'm going to become a medical assistant, so I might have to assist my provider with any sort of task he or she might want me to do. But the person that's in charge of the whole surgical thing will already have this package open. So as of now, it would be open like this. When I come in with my hands fully scrubbed and clean and ready to go, you want to make sure that the key important detail is to make sure that your hands necessarily are clean. Now, just because you have scrubbed them does not mean that they are 100% sterile. So there are certain aspects of the package that are sterile and that are not sterile. The way you open it is to make sure that your hands touch the outer rims of the package. You want to open them like this and flatten them. You also want to make sure that the right side and the left side co-align with your hands. So you open them like this, and to make sure to not touch any part of this area, because this area is sterile. And like I said, even though you have washed your hands, this is technically not sterile enough. So you can see that on the gloves, I will lift this up just for purposes and not to actually do this, that the gloves are folded like this. Since this is a key rule to applying gloves, is that you can have non-sterile to sterile, or non-sterile to non-sterile, and then sterile to sterile. So since your hands are non-sterile technically, this area right here that is folded, which will be on the inside, is non-sterile, so you may touch it. So what you do is you either take your left or right hand, whichever one you prefer, whichever one you are dominant in. I'm right-handed, so I'll use my right hand first. Is you're going to take your hand kind of and make a 4 and push it underneath and try to touch as little of the glove as possible, making sure that you do not touch anywhere else. you want to try to slide it in as much as possible, and that's about as much as I can do. So then you take your other hand and make sure that you touch it like right as so, and pull it down. Now don't worry if your fingers don't fit perfectly aligned, because I'll show you how to do that later, because the other hand gets kind of tricky. So then with this hand, you make sure that the fold is still folded, because you don't want to read anything, you don't want to mess up anything. So what you do, since this area is sterile, you want to touch the sterile to sterile, and make sure that the sterile part is touching the sterile part of the gloves. And slide your hand underneath. Now from before you could go underneath and help it, but since this is technically sterile, you have to go underneath the fold like such, and then pull under. But see how my fingers are kind of jacked up and kind of all together? You can take the sterile part and pull it out and put the gloves on, and then realign your gloves, making sure you do not touch this fold on this hand, on the first hand you did it, and tuck it under and to put them on. Now some providers may want you to double glove, and if so, then another provider will help you double glove, because obviously it's going to get more tricky because you don't have the non-sterile part to help you out. So with putting on sterile gloves, after you perform your procedure, whatever you're going to do, you obviously need to take them off. And yes, there is a correct way to take them off. Because there could be some material of anything, a number of things that could be on your gloves that you obviously don't want to touch your hands, or you wouldn't even wear the gloves in the first place. So what you do is you take your dominant hand, whichever one you want to use. Again, I'm right-handed, so I'm going to take my right hand, and I'm going to make sort of like an L, like this. And I'm going to use my thumb and my pointer finger, and I'm going to take it on my other hand and pinch in the middle, and keep pinching and keep pulling up, making sure the material that could be on the gloves does not touch my hand. I'm going to keep pinching until my hand just slides off and it goes in this other glove and makes a ball like this. So with my other hand, it's free. So then I'm going to take two fingers like this, put it underneath my glove, and kind of slowly turn it inside out, making sure that all the material that could be on my gloves is safely in here. And then these are ready to go and be thrown in the trash can. And then once that, I would obviously re-scrub again with a different scrub brush, and reopen it again and make sure everything's clean for 2 to 4 minutes, and then I'm perfectly clean. Now, I will show you the correct way without touching anything with this sterile glove pack. And another thing you want to make sure with your sterile glove packs is to make sure that if it says single use only, and that you throw them away. And you are to dispose them in the correct bin. You can't just throw it away in any old trash can, because if there was human blood on there or any other bodily fluid, you do not want that in another trash can, because it could cause contamination. And that's a whole other topic. So, as you see, we have our actual glove, and this is a size 7.5 for me. You open it up, and sometimes it's a little difficult, but that means it's good, because that means it's not open. So then you open it up just like this. And this glove, then this packaging comes a little bit different. You want to make sure that it co-aligns with your hands, right and left. Open it up by just opening up the outer rims, and that you are not touching any other part of the inside of the glove. And then to start putting on your gloves. And remember to go underneath just like this. And to help out just a little bit, and to do like that, and then you're going to take the sterile area to sterile area while you slide your non-sterile hand underneath. And again, you can help. And see, my hands sometimes get messed up, so you can take this and kind of pull it just a little bit and do that. And then you want to take it and pull it down, take it and pull it down. And see, I have perfect good hands. And again, when you wash your hands, you want to make sure everything is a waist above while you're doing it. Because if I were to drop my hands, as I were to drop my hands, they would not become sterile anymore. So then after I've performed my procedure, I'm going to again, with my right hand, because that's my dominant hand, make a L shape of my hands, pinch it in the middle of my other hand, and make it into a ball as such. Then I'm going to take my other hand with the two fingers, go underneath, and do like that, and then these will be discarded into the proper bin. And that is how you put on sterile gloves.